HHS and Veterans Service Commission to order. I know on our agenda we have welcome first, but I'm going to call the order and then we'll do our welcome. I just want to say hello to everybody. Please have some grace with me. This is my first time chairing this committee, and it's our first time that since we've combined with this reorganization that the two committees are together. So I know we'll have some kinks to work out as we go through this. I would like to start with some introductions. So we'll go around the table here, just introduce who you are and what you represent, or the department that you're representing if you're on the HHS.
Madam Chair, do you have your mic on?
I do.
We can't hear you.
I think it's working.
Yeah.
Those on view online, can you hear me?
Madam Chair, this is Administrator Langrick. I can hear you.
Okay, great. Thank you. And then we'll go back here, and then we'll also ask for introductions from those of you that are participating online. So I'll start. My name is Ingrid Glassbrenner. I've been on county board. This is my second term now, but I actually have been serving on the HHS board since 2017. I started as the RN representative before I became a county board supervisor. Ew.
I'm Megan Roan. I'm the Confidential Administrative Secretary at Health and Human Services, and I'll be supporting the committee.
Thought I did. I'm sorry. That's better. Sorry. This is Tracy Thorson. I'm the Health and Human Services Director.
I'm Don Seat, and I'm a county board supervisor. Served on HHS board for 6 years prior. Now I'm back to see you happily again.
Supervisor, been on Health and Human Services Board since probably late 2016, early 2017.
Jerry Barris, I'm a HHS board member.
Cindy Chicker, HHS board citizen member.
Yes, I'm Rose Cahood. I work as a public health manager at Health and Human Services.
Can't hear. We couldn't hear that, Rose.
I am Rose Cahood. I work as a public health manager at Health and Human Services.
Brianna Turk, Economic Support Unit Manager, Health and Human Services.
Darren Steinmetz, Economic Support Lead Worker, Health and Human Services.
Sharon Paysall, Business System Analyst, Health and Human Services.
Miranda Culver, Behavioral Health Services Manager.
Jessica Tisdale, Child and Youth Services Manager.
Roxanne Kluber-Tans-Gerber, ADRC Manager.
Jamie Bruckner, Confidential Administrative Secretary.
Angie Reisner, Administration and Building Operations Manager, and I'm the one who sends all the emails to all of you and keeps you all organized.
Karen Knock, Richland County Veteran Service Officer.
Those of you online, I think we'll start with Tim up there. If you could introduce yourself.
Hey, good morning. I'm Tim Gatchall. I'm a County Board Supervisor representing District 9. This is my second term. I was previously on HHS Board and HHS employee.
I think you guys are just going to have to take a turn and go.
Okay, this is Clint Langrick, County Administrator. I will pass it off to Danielle.
Danielle Rudersdorf. I'm a County Board Supervisor. This is my second term, sort of, and my first time on the HHS Board.
Stephanie Ronfelt, can you hear me? Okay, cool. I'm the Business and Financial Services Manager at Richland County Health and Human Services.
I'm Michael Windle. I'm the Corporation Counsel.
Sherry Hillesheim. I'm with the Veterans Board, have been for about a year.
Tammy, did you want to introduce yourself? Great. Looks like we also have Cheryl as the administrator assistant there. Hi, Cheryl.
Yes, I've got Tammy and Cheryl here from our office. I don't know if they've got audio microphones.
Oh, okay.
So I
Thank
think
you,
they're
Clint.
just monitoring from this end.
Sounds good. All right, thank you, everybody. I know that's a lot of people to remember, but we'll get to know them more as they give updates throughout the meeting. I think we have proof of notification. Saw that. Okay, so we'll move on to approve agenda. Can I have a motion for that? Right.
I'll second.
Okay, motion by Dr. Barris and second by Cindy Chicker. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? Okay. We do need to approve the Veterans Service Office previous meeting minutes, and this might be best if it was somebody who was on that committee.
Madam Chair,
Yes.
the Veterans Committee has met only once, I believe, since November. There are a number of various minutes there. Most folks, some of the folks that are here with us on the Veterans Board, HHS, were not there to participate in that meeting, in those previous meetings. I move that we accept all of those minutes as submitted.
Thank you. May I have a second?
I second that.
All right, thank you. All those in favor, please signify by saying aye. Aye.
Aye.
Any opposed? Okay, so that moves us to approve the HHS previous meeting minutes. The motion?
So moved.
I was not at that meeting, so I'm sorry. Carrie, did you?
Yep.
Okay, motion by Carrie. Second by Dr. Barris. All those in favor? Aye.
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 Any opposed? Okay, moving on to public comment. Have anyone from the public who would like to make a comment? All right. We'll move on to agenda item number 8, which is annual election of officers. Because of the way our structure is, we already have obviously the chair designated. We do need to nominate a vice chair and then a secretary. So right now I'll accept nominations for vice chair.
Severson for vice chair.
All right, do I have a second?
I'll second.
Okay, any other nominations? I think I have to ask that 3 times. Is that correct? Any other nominations? Any other nominations? All right, we'll have nominations closed for vice chair. All those in favor of Carrie as vice chair, please say aye.
Aye. Aye.
Any opposed, say no. Okay. There you go, Carrie. Our new vice chair. All right, we do need, so I actually spoke with Angie about this because I'm on another committee where we didn't actually assign a secretary because we do have somebody to take minutes already. Thank you, Megan. But she pointed out that in the event that if we went into a closed session, it's good to have somebody assigned for that purpose. Yes, Carrie?
I always look at the secretary as not only for that, but in case the chair and the vice chair are absent, that the secretary then could chair the meeting.
Good point. So we do need nominations for that position.
Oh, I would do it.
Okay.
I would nominate Cindy Chicker.
All right. Do I have a second? Okay. Nomination by Carrie, second by Dr. Barris. Any other nominations? Any other nominations? Any other nominations? All right, nominations for secretary are closed. All those in favor of Cindy Chicker as secretary, please say aye.
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 Any opposed? Okay,
Madam Chair, it's my understanding
Yes.
that the secretary is basically in name only, except in the absence of the chair and vice chair would act as chair. The
correct.
official secretarial minutes are, administrative minutes are taken by staff. Is that correct?
That's correct. Megan here does a great job taking our minutes. All right, we're going to move on to agenda item number 9, subcommittee appointments. Actually, since we have Mr. Langrick on the line, maybe you can answer this. Clint, we left this on our agenda, but we actually think that maybe you appoint these 2 positions. It's to the Comprehensive Community Services Coordination Committee and the Coordinated Services Team Coordinating Committee. Is that correct?
Citizen members are a duty that you've put on to me as the administrator, and I can take care of that. At the same time, if the committee would like to take any type of an action to recommend to me who they would like to fulfill in those positions, that would also be welcomed.
Okay. So I see Miranda's here. You're going to describe what those are? Thank you.
Don, you guys. So the Coordinated Services Committee meets quarterly, although with COVID, we did not do that all of last year or parts of last year due to not having quorum at all times. Our Coordinated Services Team Committee is a wraparound services program for children in need of services. The committee, both committees for Comprehensive Community Services and the Coordinated Services Team looks at policies and procedures throughout the year, also looks at the budget, though it does not make any budget decisions throughout the year. The Comprehensive Community Services Committee also again looks at policies, approves our annual plan, and meets quarterly throughout the year.
Sorry. Son.
Madam Chair,
No, it is. Yes, Mr. Steve.
may I ask that folks speak up a little more? It's difficult to hear here.
Okay, thank you.
You have to put your mouth close to the mic. That will help. Just kiss the mic.
Cindy, were you had been sitting on one of those?
I believe I was on the CST coordinating committee.
Okay.
And as Miranda stated, we didn't meet real often. That said, it's really hard to keep it on a calendar when it is meeting. And I know that I missed at least 1 or 2 of the meetings in the 2 years I served on it. I would be willing to do it again, but just it's like I said, it's difficult to coordinate with everything else.
Okay. Do I have anyone who's interested in either of these committees?
Do one.
Okay. Do you want to do the one that you were doing prior?
Sure.
So
that would be fine. I believe it was the coordinated services team, was it, Miranda?
Yes.
Okay.
So, Madam Chair,
Yes.
there were some other subcommittees, quote unquote, that fell under Health and Human Services prior, like the Mississippi Valley. I think Ken's on that one, or
We have the
Dr. Barris
transportation
on that
coordinating one too.
Yeah. So, who from these committees are on those committees, or are they just?
So I have I think these 2 were not on this list that we got, and I don't think that they have the final approval of those are on there, but I think Danielle, I believe you're on let me double check here. I believe Danielle's on the transportation, has tentatively been assigned to the transportation committee. And what was the other one?
I think Mississippi Valley. I think there's a couple, right, Tracy, that there was a few that just
Ken.
had a representative from Health and Human Services Board representing those committees. And without having that sheet from, I guess I can look it up on here.
Looks like Ken is on the Mississippi Valley tentatively. So then those of you who don't have an assignment, who would like to take the last one here? Dr. Barris, are you interested in the Comprehensive Community Services? Okay. Well, and it looks like So you were on that prior. We have on our list here behind it that it says it's a supervisor, so I don't know if that means that now they want it to be. Oh. This one would meet quarterly. Would you be okay with that?
Yeah.
Okay.
They're very short.
Short meeting. So do we need to make a motion then to recommend those?
Madam Chair, I'm not sure that you have. It would be helpful because then it's coming directly from the committee to make a motion.
Okay.
Then it would go to the county administrator, of course, to make the appointment.
Okay, so I need a motion to appoint Dr. Barris or recommend to appoint Dr. Barris to the Comprehensive Community Services and then Cindy Chicker to the Coordinated Services team.
Gary Severson moves.
Okay, can I have a second? Okay, thank you. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Okay. All right, number 10, discuss HHS and Veteran Standing Committee restructuring issues. So Tracy, you can correct me if I'm wrong here. Initially, one of the complications we found was that for a local board of health, we were statutorily defined to have 9 members for that. And because now our standing committee has 11 members, we were going to run into a problem when we had things that were relating to local board of health. That isn't everything that we have on a typical HHS agenda. It's more public health type of updates and things that would need motions on that. That actually was taken care of though at our last rules meeting. What we did was we decided to make the veterans service or the veterans citizen members to be non-voting members on matters regarding or relating to the local board of health. So if we ever have anything in our meeting that would pertain to a local board of health decision, then those 2 members would be non-voting on that, and that fulfills that requirement. Did I state that correctly?
Yes,
Tracy?
Madam Chair. Just one thing to add is that was approved by the Rules and Strategic Planning Committee and still needs to go to County Board for final approval for changing that committee structure. We do have one item on the agenda today, but I believe the whole Health and Human Services Veterans Committee could vote on that.
We have one item that would be a local board of health item?
It's related to local board of health, but it's also related to authorizing funds to be utilized for a contract. So I think it would be appropriate for this committee to go ahead and vote, even though that committee structure hasn't been changed yet.
Okay. So that was one of the big issues why we put that on there. But now that's been mostly taken care of as long as it's passed by county board. The other thing I did want to talk about though, was that the way that we restructured in that new document leaves it kind of open to committees to decide what members are voting on what as far as the citizen members. And we don't have both of our veterans citizen members here today, but one of the things we had discussed when I met with Tracy and I think Angie when we were looking at how are we going to structure this agenda was we thought about we could put anything that's relating to the Veterans Commission at the beginning of the agenda. And if the veterans citizen members did not want to be voting members on matters of HHS, then once we get through those items that would pertain to that committee, that portion of the committee, then they would be free. They wouldn't have to stay for the entire meeting. However, I would need kind of feedback from you guys as a committee and from the citizen members if that is something that they would be interested in. I don't know if that made sense. Sherry, did you understand what I was saying?
Yes, I did, and it makes sense to me. So
okay,
I approve.
Oh, okay. So are you saying that you would prefer not to be a voting member on matters of HHS?
I don't know much about it. Maybe I shouldn't say one way or the other. I'm still new at all this. So anyway, but I'm certainly in favor of streamlining however we can.
Okay. Yes, Tracy.
Madam Chair, the one situation that could create an issue for that is if we were struggling to have quorum, that those are members of the whole committee. So potentially they might need to be present for us to continue the meeting. A
Yeah.
larger committee, of course,
Yeah,
you may
requires.
not run into that very often.
Yes, Carrie.
Also feel that since we did this restructuring and that the veterans was combined, that this is a committee of a whole and not separate. And
Mhm.
why did we even do a restructure then if we're going to start dividing up different committees?
I understand that too. I just wanted to put it out there if, anybody had strong feelings on it, because it will create, hopefully we can streamline these meetings so they're not super long, but they are going to be a little longer. Yes.
Yeah, Madam Chair, the agenda does need to set forth boundaries of separating veterans and HHS. I think the idea of doing veterans first, because it's obviously going to be a more minor of the agenda, that we have the opportunity to release the citizen members of veterans. And to answer Tracy's problem, at the time of the roll call, we would know if we had a quorum, so we could just ask one of the veterans members to just stay on with us.
Are you saying that you would leave them as voting members, but we'd give them the option to leave?
If
I don't think that works.
if we have a quorum, then the citizen members can leave.
Oh, is that,
But if we didn't have a quorum, we could ask one of them to stay.
that work?
And
I
of
think
course,
that's what Tracy was kind of saying.
Yes, I think that the biggest issue is having a quorum for the whole meeting. And so if some members, it could be veterans representatives, or it could be other members, could be excused to leave the meeting if they needed to leave. But
Okay.
if there was a quorum, I think then they'd be asked to stay.
Did you want to add anything? Okay.
Yeah.
Well, why don't we leave it as is for now and we'll see how it goes. Yes.
Madam Chair, that is not to say that those citizen members who could be excused are not welcome to stay.
Of course. Yes. Thank you. Before we move on, so I know again this is like the first time that we've met, and we tentatively put together this agenda the way it's structured like this. But if you guys have any thoughts or want to see something changed, please let me know. All right. I think we'll move on then to, I guess that was number 11, the agenda item topics and organization. So how we did it so far, and pertaining to what you said, Ken, is that we did put the veteran service, the budget summary, and their report at the beginning. So it will be a little bit separated if we leave it like that, which I'm fine doing it that way. The other thing, as far as the agenda, this is different from the way that we've put it before, is that we've grouped items, and Angie can correct me if I state this incorrectly, but like numbers 14 through 16 are consent items, so they're not anything that we actually have to make a motion on. They're just pertaining to reports. And then action items, so numbers 19 through 22, we will actually have to make action on. One of the other questions I have for the committee is, because we do not actually make actions on the expenditures, so number 14, there is an option that we could have to streamline this meeting where we would have that information in our packet. We can leave it on the agenda, but we don't actually have to discuss it every meeting unless somebody wants to. So that was kind of my proposal for one way to, well, not my proposal, that was actually Tracy's proposal, which I thought was great to kind of try to streamline. Does anybody have objections to doing it that way?
We've done that at least when I was working. There were a number of committees and board committees that did operate like that. And you just ask for approval of the items on the consent agenda. We'll first ask if anybody wanted to pull something out, and then approval of the items on the consent agenda, and go forth from there, nicely, quickly, and easily.
Yeah. I think one of the issues was, and we actually discussed this at our last rules and resolution meeting, is that for some boards, we do still have to actually put through an approval at this point. For this board, however, because of the way I think it's actually outlined in the statute.
Madam Chair, I believe it's also the rules of the county board make a couple of exceptions for what expenditures are approved by the committee, which are approved by the county administrator, and which can be approved by the department head.
Okay, so Tracy and Clint are currently who go over and approve the purchases. So It's mainly informational for us, so if you guys don't have objections, I think if we just have it in our packets and we review it, if anyone has a question or wants to discuss it, then it's on the agenda, we can. Otherwise, we'll just go on as information only. Good with that? Okay. Today, though, because I know we have some new members, I think we will go over it just to show them how it works. Was there any other, I'm trying to remember, Tracy, if you had other ideas for anything that could be, you know, that we didn't have to discuss.
No, I don't believe so, Madam.
Okay. All right, so that moves us to item number 12, the Veterans 2022 Veterans Budget Summary. Hi, Karen.
Thanks. So the budget summary has been posted for you all to see. We have very low expenses. We have one of the lowest budgets in the county to maintain. Last month I had 2 expenses, the phone bill, and we also paid for hotel fees for when I was at conference. And if you have any other questions about the budget, I'd be happy to answer them. It was in the committee files under veterans. It's in what we call the N file. I don't know what they call it on the iPads.
She went into the original one and not the post organization, Madam Chair.
Pre-reorganization one?
Yes, the
Oh, I'm sorry. I did do that. I guess I didn't realize that there was a new one.
That's okay. I'll just show you. So now we have 2022 post reorg. And so then they've combined Health and Human Services and Veterans there.
Thank you.
Yeah.
So I did put it into the previous
Veterans
2022.
Okay.
I did. I'm sorry.
No, that's all right. I'll pull it up so I can see. Which one were we looking at?
So those are the 4 different pages that I use.
Okay.
So the disbursements, the totals, and the expenditures.
Okay.
So those are all the different accounts that I have.
Thank you.
Mm-hmm.
So if anyone else didn't know where to find that, that was in our folder 2022 post, or the pre one that does not say post reorg under veterans. All right, does anybody have any questions for Karen?
Did you ask for questions? I'm sorry, I didn't hear you.
Yes.
Yes,
Mr. Seep, do you have a question?
The budget that you're reporting on is for the period January to the end of April, is that correct?
Correct. The expenses only reflect April though.
And your application for a grant last year, last December, was for 8,500 or 9,350?
9,350 is what was finally approved after the grant came out.
And did you receive the 9,350?
Yes, we did. It was located, or it was submitted to the county administrator and cashed through the treasurer's office.
I noticed that on the grant part of the budget, the amount spent, it starts out with a budget of $6,900 and some dollars. Where is the rest of that allocated?
Some of it goes towards salary, whereas the rest of it sits in the page alone to show where it goes.
Pardon? I didn't hear your answer.
Some of it goes towards salary. There's a whole page in the budget that reflects where the grant money goes.
Do you have the details on that?
It's on the computer. I didn't bring my laptop with me.
It's in a folder on your computer. I can show you later, Mr. Seep, if you want, or do you need more information right now?
Thank you. I don't have any more questions at this time. It's pretty minimal.
Karen, then I'll ask you to give an administrator report, maybe give us a little overview of what you guys do.
I was hired by the county in 2015. I've been here 7 years, happily. I was elected in 2015 and I was reelected 2 years later on January of 2017, which gave me tenure. I oversee the entire department, the budget, the advertising. We host many events. We just got done hosting the Blue to Gold Star ceremony that was held April 5th. If any of you guys saw that in the newspaper. Most of what we do is help veterans apply for benefits, the disability compensation. In 2014, before I got here, the federal government paid Richland County $8 million in cash and benefits. In 2020, which is the last numbers that came out, my office has successfully helped to raise that to over $12 million. So we bring in a lot of cash, and we put that cash into the pockets of the veterans who go out into the community and spend it. We help veterans apply for property tax reimbursement for some veterans. We help them attain health insurance, health benefits. We work with several state departments, the DOT, the DMV, the Wisconsin Department of Veterans Affairs, a myriad, a DNR. We work with a myriad of different to apply for state benefits. We also work with local benefits. There is a needy veterans fund that the American Legion, along with a couple others, run. There's also money that can come from the VFW state when veterans fall on hard times. There's also other benefits like Heat for Heroes and things like that. I always say that my job is to not know everything, it's know how to find everything. And that's a big part of the job, is to locate resources to help veterans. We work with birth through death, anything and everything. We can have records changed. I've had numerous times I've had to have death certificates changed so that the next of kin can claim the benefits that they're due if something was listed wrong. Anything veteran related. We work with cemeteries to help with the care of veterans' graves, which is covered in Chapter 45 of the state statutes. We work with the Register of Deeds office when we need to obtain records, marriage certificates, death certificates. We work with the jail frequently when it comes to incarcerated veterans or veterans that have been arrested recently. We work with land conservation, zoning department when it comes to cemeteries. Lynn Newkirk, she's amazing on keeping track. We have over 100 cemeteries. So we have lots of veterans, even after they've passed, that we have to kind of help maintain the care of graves on. Occasionally we work with the DA's office, and that's pretty much it. We're very individualized. There's no department that can kind of compare with us. And we do our best to help veterans in any way, shape, or form, whether it's a mental health crisis and they're calling me at 2 a.m., or if it's 9 o'clock in the morning and they haven't been able to sleep because they had insomnia all night, or if it's somebody that just got diagnosed with prostate cancer. No matter what, I post my cell phone frequently online so that veterans can get a hold of me at any time, whether it be domestic violence at 3 o'clock in the morning. We do house visits so that we can make sure that veterans that are too sick to come into the office, that we can still see them. So we do quite a lot, actually, through our office, and I'm very proud of the job that we do.
Thank you, Karen. Does anybody have any questions for her?
I have a couple of minor questions. Karen, appreciate your report. I was intrigued when you said that you take 2 a.m. phone calls. How do clients get your personal phone number?
I post it on the office door, and as well as I publicize it. And sometimes I even have it on email responses and on the answering machine in the office.
But, you know, there's nothing that requires you to be available 24/7. Your office is 8 to 4:30 or whatever the case may be. And if somebody called you for a mental health crisis, I'm very curious as to how that happens. The county has a crisis line. which, and they have staff who respond to those crises in conjunction with the sheriff's department. They're social workers. It seems to me that one who is in your position would be possibly or potentially endangering yourself. You're not certified to counsel people for mental health, or you know you're a veteran service officer who basically your job is to assist veterans who come to the office or go to their home on occasion, to assist them in applying for benefits or compensation from the VA, state, local, or federal. So I don't understand where this 24/7 perception of your duties comes from, and I think it endangers. I don't believe a social worker would give out their personal phone number or publish it on the door for people to call them. I'd like the input from the social work community. Maybe they can be helpful to you in terms of advising you how people can be referred to crisis. If you had a notice on your door that let people know how to call for crisis, which I'm sure you have, but I think it's very seriously dangerous and a risk, not only to you, but you represent the county, a risk to Richland County as well. I would caution you to be very careful with that and get some advice from our attorney as well as from professional social workers.
Okay, thank you, Supervisor Steve.
Madam
Supervisor
Chair,
Reddish?
Karen, I just had a question. Somebody had shared some concerns about, I just wonder where we're at with hiring you an assistant, because there were some concerns that, you're here now, so that means the office is not staffed. Somebody comes in and, if they need a D-214 for a burial, that's kind of a critical thing. So between you or Clint, I just wonder kind of where we're at on getting the second position filled.
I wholeheartedly agree with your concern. It's been a concern of mine. The county requested that I wait 90 days, which would be June 1st. So it was actually today I was planning on contacting the county administrator so that we could review the job description, so that I could start to look forward to hiring for that position. But I wholeheartedly concur with you. Longer hours in the office does nothing to help, but a second set of eyes and ears is what I really need in that office during those hours. Thank you. I appreciate that.
Well, I would just like to reiterate, and I know Clint's on here, and that the office needs to be staffed from whatever your hours are. We need to have somebody in there.
I agree.
It's no different than the register of deeds or the clerk. I mean, the community comes in and the office door is closed. We can't have that.
Madam Chair,
Yes, briefly, Supervisor Steve.
just a bit of history here. For a period of 90 days, the staffing and the workload of the office is under evaluation at the administrator's direction. Historically, we've had a variety of approaches to staffing. We had a clerical assistant at one time. We had an assistant veteran service officer part-time at one time. And then we had a benefit specialist most recently. Those have all been part-time positions, anywhere from 17 to 20 hours a week. That is, with all due respect, the administrator is taking a good look at this from the vantage point of evaluating the workload, as well as the staffing needs, and as well as the needs of the veteran population. We have been requiring or requesting a study in the form of 2 reports that are compiled monthly, daily and monthly, by the Veterans Service Office to record the number of calls, the number of visits to the office, the number of people who are served for various categories of assistance. So we will be probably zooming that. That's up to the committee, I suppose.
Supervisor
But those
Seif,
were very valuable reports that they have not been brought up to date yet. But that is part of measuring, part of providing the metrics for objectively measuring time analysis,
Supervisor Seif, I think we're getting off agenda topic here. So we're gonna get back on track,
Thank
okay?
you.
We can, if we need to discuss
that
this
answers
further,
the
we can
question.
put it as an agenda item. Yes, thank you. Does anyone else have any questions for Karen before she goes? Okay, thank you, and it was nice to meet you. All right, we'll move on to agenda item number 14, the expenditures report. I would ask as we move through these that you guys could give a little bit of background for our new members on what we're doing. Angie.
Hi, everyone. Oh, do I have the wrong notes pulled up first? That's not, I need the expenditures report. That's the, oh, there, the voucher handout. Perfect. While that's pulling up, yeah, earlier I introduced myself. I'm Stephanie Ronfeld, the Business and Financial Services Manager at Richland County Health and Human Services. And for those board members that don't know this, every month I take these vouchers, meet with Clint Langrick, and we go through them together, and he approves them for payment. So in the past, these vouchers did get approved by the board or the committee, but since then this has changed. So as was mentioned earlier, in the future, we'll just go ahead and we'll have this voucher document available as a handout, and during the meeting, if anyone notices anything that they have questions about, they can definitely ask. But to kind of go through it so you can kind of understand what some of the highlights are, and what has brought up questions in the past, we can just go through it today. So as you can see on this first page, we're going to have we're going to be spending $37,347.04 on various bills. If we go to the next page, page 1, and then if we go to page 2, these first 2 pages are just standard monthly transportation program mileage reimbursements. So these are our transportation drivers, and we help them out with mileage reimbursement so they can continue helping help us with that. And those are just standard. Those will show up every month. Then if we go to the next page, page 4, these are page 4 through, I believe, page 7 or 8. These are bills that we pay pretty much every month for various reasons. Page 3 and 4 this particular month, the bulk of those 2 pages are credit card charges totaling $6,408.82. You can see on page 4. On page 3, there's various $90 training fees for staff and professionals who attended the Wisconsin Association of Treatment Court Professionals Conference. And this was covered by grant dollars. Then you'll see there's $1,389.76, item 24 on page 3. That's for our electronic health record system. We call it Curio. You'll see those every month. So if you have any questions about those higher amounts, you can definitely ask. If we jump to page 4, I just kind of want to point out on page 3 and page 4, you'll see like at the top there, $832.36. That item and a couple of the other items charged to the credit card were for client services that we paid for out of what's called the CCOP program. These are families with children with disabilities, and we'll help out occasionally with different recreational activities for those kiddos. And And then also on page 4, there were various registration items that you'll see. We had someone attend or will be attending an opioid trauma summit. We're doing a background check training, and then there was a training for ethics and boundaries. Also on page 4, $621.15 was for meal trays used for our frozen meal program. So that's paid for out of nutrition program funding. If we go to page 5, many of these items are self-explanatory. You can see photocopies. We have our lease, and then we have to pay for copies every month. The $2,125 is for our contract for environmental health services with Grant County. We have Troy Morris that comes in, and that's one of his, I believe it's quarterly payments that we make. And then pelletory waste systems, that's our shredder, the company we use to shred our confidential material. If we want to go to page 6, then there's a highlight there. You'll see food supplies, $7,846.85, item 32. So interesting this month, normally what happens with the Richland County Food Service is we pay those as a prepaid. But with this meeting being a little bit later in the month, you'll see later on this report that we paid March, and this is actually April came in, and we were able to get that on this, get this paid this round with these vouchers. So normally, like I said, that's done as a prepaid. And also on page 6, we had a very high month for costs with the shopping news. Shopping news was $2,177 total. You'll see the vendor total there. Mostly hiring ads, including the ad runs for the director's position. And the $315 is for outreach for our WEEP program, which we have to do outreach as a requirement of that program. And then finally, if you go to page 8, these are our previously paid. So for those of you that don't know this, some items we do pay before we reach, before we get approval from Clint. So we get kind of a post approval, because these are items that, like Quick Trip, Premier Co-op, utility companies, Walmart. If we don't pay those by the due date, then we end up with late charges and things like that. So this is just an FYI that these were items that we had already paid for today's meeting. And that is, I guess, what'll be my last formal voucher report. Does anybody have any questions?
Ask a quick question. The
Sure.
electronic medical record, did we originally purchase that, or what's the $1,000 a month fee for?
So we have to pay for every provider to have access to the system. So it's kind of like a monthly subscription. Yes. So we paid for the
license fee for each provider?
License fee. Yep. Yeah.
Do you actually own the record? Did we have an upfront cost where we actually bought the electronic medical record like we did at the hospital?
Correct. Right. Tracy, you'll have to help me on that one. I'm newer I wasn't involved when we added that.
Madam Chair, the record is a subscription fee for us to have access to that record. We don't own the software for it.
Right, like a Microsoft thing that you just have a license fee.
Right.
Okay. Thank you, Stephanie. Yes, Supervisor Steep.
Madam Chair, I request to be excused. I have a medical appointment in Caribou.
Okay.
And my wife has to pick me up, and she's not as good a driver as I am.
Certainly, Supervisor Steep. Have a good day. Okay, thank you, Stephanie. All right, that moves us to item number 15, the budget summary.
Which is also me. Okay, great. All right, everyone. So the data for this particular report was actually pulled on May 5th. And if we're doing some estimating utilization should be at about 33%, because this would be through the end of April. So you can see that what was budgeted and what's actually been spent, for those of you that haven't seen one of these reports before, you can see the budgeted amount, the actual amount in the next column, and then percent utilized. So we'd like to try and see if we're at our 33%. And then what we do is then I go through and kind of explain if we're not at 33%, what are some of the factors as to why that's the case. The one thing that we did kind of note as we were kind of going through all the different expenses, and it's especially noticeable on like the administrative services staff line, where we're only at 26.8%. One of the things is we haven't had any 3 paycheck months yet this year. That first one won't be until July. So if it's mostly staffing costs that's involved in a budget line, that's going to be a little low. Same with like the ESS program. That's why it's like at 31%, and things like that. So kind of just an overall note there. For public health, another thing kind of to note on the staffing costs, we're kind of early in the year too, so a lot of staff have not tapped into their health insurance reimbursement benefit as of yet either. Public health, slightly down. I know in the past we've seen that pretty high for most of 2021, but so far this year, contact tracing costs have been low. We've also had there's always a little bit of delayed billing with Southwest Workforce Development Board, our contracted people. I think we've received invoices through March, so that's going to be a little bit low if we have any contracted staff in those areas. If we go down to the Aging and Disability Resource Center and Elderly Services, that's a little bit low. Talked with the ADRC director yesterday, and that is the bulk of those costs expenses are transportation, or the transportation program. And right now utilization is a little bit low, but just note that transportation services traditionally fluctuate. It's just trending a little bit low right now. If we go down to child and youth services, children and youth programs, that is the reason that is only at 20.3% utilization is we are 3 social workers, 3 vacancies, I believe is what we discussed as a team, talking about why those expenses are so low, and we have several vacancies there. And then CPS contractual services, that budget line, we had the ability to request funding for various legal purposes. So we had to have a budget line to put that funding for legal services in the event we need to move forward with any formal changes. And as of this date, we haven't had to use any of that legal funding, so that's why that's low. If we go to behavioral health, a few things of note here: mental health, outpatient, and crisis services. The prime reason for the utilization being low there is we have an APS crisis position that we budgeted for that we have not filled. We have a couple of master's level therapist positions that are not filled either. CCS, if we go to CCS is only at 4.7%, but what we should note with CCS is we're always a couple months behind on the billing for that, or paying the expenses for that. So we're just now starting to get things in for April. So if we were to, so that's not really at 33%, that you could really only look at that as like a 2 months of expenses. So if we were to add in the next 2 months, that would definitely bring us up a little bit there. APS, Adult Protective Services, 4.9% vacant position, which we just filled here a couple of weeks ago. So we should start seeing that tick up a little bit as far as the expenses there. Let's see, and I think birth to 3, you'll see that's on the other side of 33%, 35.2%. Just that that's just due to our therapy services that are just more expensive than anticipated or expected. Anybody have any question about any of the expenses before I move to the core budget balance? Nope. Okay. So then once we have all of the expenses figured out, then we kind of look at where are we with revenues and what do we think our core budget is going to look like. Super year-end projections. And in April, it is a huge projection because there's a lot of year to go left and a lot of factors that go into this. First, I'd like to note that I have a typo up there. It should be core budget balance through April. Sorry about that. But you can see, so our actual expenses match the actual column. And then if we look at received revenue and monthly tax levy, the revenue we've actually received to date after doing our claiming, plus a prorated amount of tax levy, our revenues at $1.1 million. Anticipated revenue of $970,920. What that is 2 months worth of, actually almost 2 months worth for many of the programs of revenue that we anticipate. We have submitted, all claims have been submitted for our March and September expenses, and now we're just waiting for that revenue to come in and hit the books. So so once all that revenue comes in as we expect it should, we get reimbursed for these expenses for most of these, pretty much almost all of these programs. You subtract that from our actual expenses, some anticipated expenses, which the bulk of that is CCS bills that we have to pay for April, actually March and April. We're actually looking at a budget balance of about $68,028. An interesting thing we have to do with our Health and Human Services budget is when we place somebody at Winnebago, the state of Wisconsin, any claims that we submit for our behavioral health programs, the claims we submit, if we owe Winnebago money, they subtract it from our claim. And so even though it's a placement cost, that's how we pay the state. So then what ends up happening is we have to do these different, we have to do that chargeback is. We have to move some money around, do some journal entry corrections, and then that way that revenue, those expenses don't come out of our actual core budget expenses. So it's a thing we have to do. Once we are reimbursed, so to speak, from the placement fund, then we can put that back in. Normally, where you see chargeback for Mental Health Institute through March, normally that would be a positive number, not a negative number. We just happened to get a really high reimbursement for the month of March through this process from the state of Wisconsin. So what's actually makes it look like our year-end projections are going to be a little bit lower because now we got to take that money and give it back to the placement funds. New core year-end projection after that fund chargeback, it looks like we're going to end the year in a positive manner. So, but again, it's April, long way to go. So,
if I could, Madam Chair, Stephanie, I think that it's not a year-end projection, it's a point-in-time projection that we are roughly $50,000 to the good in our budget at this point.
Yes. Yeah. Sorry. That I can update the report for next month to show that. So, but point in time. Any questions? No? Great.
So, Madam Chair, what we usually do then is we roll right into the placement reports. Would you like us to go forward with that? Those are part of the overall budget report.
Thank you. Should we explain that section at the end just a little bit?
Sure.
Do you think that would hurt enough?
The numbers on the far right of the table are related to placements and what the placement funds, what's been charged to the placement funds. And our placement report actually goes to that in detail, but we start the year, this year was $1,485,000 in tax levy was put into those combined adult and child funds. And so far for Fund 54, which is the adult placement fund, we have had total expenses, I believe in, gosh, help me out here, Stephanie, I'm struggling. Oh, the total expenses of $26,450 was that Winnebago mental health charges that that gets charged back, and then $85,000 in other placement funds for adults. And in the child placement fund, we've had $166,000 roughly in placement expenses, leaving a balance of $533,000. As far as the placement reports go, these reports kind of help you see what's happening with our placements, and our Behavioral Health Services Manager and Child and Youth Services Manager are going to walk you through those.
Can everyone hear me okay? So I'll do a little bit more explanation since there's new board members here for the adult institutional and inpatient placements. So just a little bit of history about this. The adult institutional and inpatient placements are for individuals that are typically under mental health commitments, once in a while under guardianships, or placed in the state institution, typically Winnebago. Also included in this cost are private hospitalizations for individuals who do not have health insurance that are under those mental health commitments. As you can see, for March, there were 4 individuals in the placements, a total of 19 days of stay. The cost of stay is listed at approximately $25,000. And then there are 2 ways that there are reimbursements for those placements. There's reimbursements through private health insurances or Medicare. Medicaid does not pay for the Winnebago mental health stays, or county tax levy, but the reimbursements that you will always see listed on here are either private health insurance or Medicare that has funded those placements. So trending lower the first quarter of the year. The next area, the crisis stabilization area, is a step down typically, or where someone may go prior to a mental health hospitalization. Still a level of care to keep individuals safe that are a danger to themselves or others. That level of care is in the community. We contract with Tularian. There's a facility in Madison and a facility in La Crosse County that we use for that. That type of stay is also reimbursable through Medicaid and some private insurances. It's not fully funded, reimbursed, but typically we do get some reimbursements. You can see listed there through Medicaid. Always, if an individual is in need of services, the crisis stabilization is preferred over institutional costs. Of course, it's a lower level of care for the individual, and it's a lower cost of stay. So just looking, as it was discussed, year to date, we've had, I believe that's incorrect. We've had 2 people in crisis stabilization, and then 8 individuals in the institutional cost, or in the institutions, with 52,000 spent and a little over 11,000.
Can I just ask a question quick on the up on the top one for the institutional? The colors are supposed to represent the number of patients, right? But it looks like they're not lining up.
It does, yeah, I can see. Yeah.
Is that just or am I misreading it?
Well, Miranda can correct me if I'm wrong. So like, for instance, on, you see the dark blue in January, that would represent one individual. And if that same color is present in the next bar, that person also was in that month. So the same with this light blue color. This would represent the same person, and the longer the bar, the more number of days that the
so
person was in.
It's just different individuals then, so
That's
it would roll over. Okay, my bad. Thank you.
So the next area, let's try again. The adult community residential placements. So those individuals are also always under a mental health commitment or a guardianship. Those placements are used when individuals need psychosocial rehabilitation services or need assistance caring for themselves in the community to be safe. Some individuals, as you'll see in the annual report, some individuals use those stays just temporarily until they can reintegrate into a less restrictive measure or less restrictive housing. Some individuals need those placements long term. Those placements are funded a couple different ways. Our Comprehensive Community Services Program funds the psychosocial rehabilitation services in those placements, so we do get some revenue in that way. As well, individuals do have a room and board fee if they're able to pay that. As well, then that does go into the placement funds and tax levy covers there. So you can see that we increased from 8 to 9 individuals in March. Different bars are different individuals that carry over from month to month. One thing that's important to note, the county expenses about $21,000 for that at this point in the year. We do try to absorb some of those comprehensive community services costs into the Health and Human Services budget as we get reimbursements for those psychosocial rehabilitation services. However, if that cost surpasses the revenues that we get through comprehensive community services, additional costs in these types of placements may be put back into Fund 54 as the year goes on. Are there any questions about that?
So I'll just add to summarize at the bottom of your report on that page, you'll see just kind of the total tax levy that is set aside in that adult placement fund, how much in expense has been applied to that and what the remaining amount is. So like Miranda said, we do have a little bit lower utilization than you would expect for 3 months of placements. We're at 11% of the amount that was budgeted. And I believe Jessica will talk about the child placement funds.
Yes. So similar to the adult placements, we'll go through the children's placements. So they are again grouped. So the first grouping is institutional, inpatient, and detention placements. Currently, we have one longstanding placement who is in a residential facility. Right now, we do not have any detentions to report, nor have we had any mental health hospitalizations for youth for the recent months. There was one additional, you'll see in January, frequently we'll see those institutional mental health hospitalizations for youth represented as a second person in that institutional column. So currently for year-to-date institutionals, the county's expense is $38,219, and year-to-date detention, we are at 0 at this point in time. And then we can move on to the foster care and treatment foster care placements. So these are community-based family type setting placements for youth who are in out-of-home care due to abuse and neglect, or youth justice, or previously known as delinquency. So you'll see that at this point in time in group homes and treatment foster homes, we have 11 youth with a total of 341 days in the month of March. And that's group homes and treatment foster care. So those would be higher level needs children who are placed in, so group homes would be a 24-hour staff facility that is meant to meet the needs of a higher level of need youth. Treatment foster cares are frequently used if we have large sibling placements or behavioral needs of children that can't be managed in a regular level foster home. So that again would be 11 youth in those placements. And then we do have 7 youth who are placed in regular foster care at this point in time. Both of those numbers for treatment foster home, group homes, and regular foster care have been managing steady throughout this year. So the total county expense right now is $116,000, almost $117,000 for the group home and treatment foster care, and then an additional almost $11,000 for county expense on the foster care. So you'll see at the beginning balances at the beginning of the year, the total expenditures of $166,000, and the remaining balance for Fund 44 as $533,902. Any questions regarding those?
Madam Chair, we do have a few other charts and reports. Would you like us to go ahead and walk you through those?
Yeah, I think that would be good.
I believe Miranda or Jessica is going to talk about these.
So the annual days of stay by placement type, you will see the numbers on there listed. That is just the year to date. The top line, the dark blue line, is the year to date total of days in each placement type. It's not projected out through the calendar year. So that's where we are at right now.
I'm going to have to just close that and open it.
The adult institutional and inpatient costs that is on the next graph is projected to year end at $208,982. I would say it's early in the year, and that projection may certainly change with all of these as the year goes on. The adult community placements are again projected to end $86,415. Again, that cost may come up if we find that our comprehensive community services revenues cannot fully absorb one large placement that we're looking at. And then the adult crisis stabilization is projected to end roughly where it ended last year, just a little bit lower at $47,489.
The child institutional and residential treatment, you'll see that's trending a little bit lower at this point of the year. As Miranda spoke, it is early in the year, and that can vary depending upon mental health placements for youth in an institutional setting. So we'll have a better projection on that later in the year. Juvenile detention, you'll see we're trending right now at nothing. We haven't had any placements, but you will see in 2020 from this graph that we had an extensive amount that year, and then it returned back down to a fairly reasonable level, and now we're at 0. So it really just depends on the youth that we're serving, their behaviors and their safety level in the community, and whether or not they require that level of placement and restriction to ensure that community safety and their safety is managed. Youth group home and treatment foster care, you'll see that we're trending a bit higher than we were last year. Some of that is due to the fact that we have more placements this year than we did in the previous year. So we're seeing that it's potentially going to be ending higher as well. Regular foster care would be the same. We're seeing more placements this year than we did in the previous year, or placements that occurred at the end of last year that have carried over into this year. So it's just the number of youth that we're serving who are in out-of-home placements is larger this year than they were last year.
Great, thank you guys. Which one is this, Tracy?
So this chart just shows you all of the placement expenses combined. So this gives you a history over the last, gosh, almost 9, 10 years of what our placement expenses have been. And the blue bar shows you expenses. That green kind of chart behind that shows you how much tax levy had been put in for those. So if you see here at the 2022, the county put in a substantially higher amount of tax levy to try to cover what those expenses would be. Right now, with those first 3 months of the year, if the rest of the year continues the same, we would end the year with roughly $1 million in placement expenses. And like Miranda and Jessica said, it's early in the year. It's a little hard to make that projection with only 3 months. But it does look like we are looking pretty good to start with. And then I'll just share the next chart on that report. Just gives you what a month-to-month placement expenses look like to compare from year to year. You can see with all of the ups and downs, that's how variable placements can be. So we can't really predict trends in terms of March is a heavy month or a low utilization month. That's just the nature of placements and the individuals who might need that service. And those are all the reports. Thank you, Madam Chair.
Thank you. Yes, Supervisor Renish.
Sorry. Are a lot of these placements contractual, or are they potentially, can we see an impact of inflation at our year end?
We do have a contract with nearly every placement provider. So we get the rate set usually prior to the year beginning, and that rate remains for the year.
Any other questions? Okay, thank you guys. That moves us to item number 16, which is the contract monitoring report. Am I using this right? There we go. So this is a good transition. I'm going to now be talking about contracts, which is something that I take care of for our department. Roughly 100 contracts are approved and reviewed and distributed at the end of every year in October. For the next calendar year, it's about, I think, just under $7 million in placements, purchase of service contracts. So what I do then every month is review those after they're mailed out. I, in essence, go out to our county checkbook on AS400 and I see what's actually been spent. So I'm more of like the auditor. I make sure everyone has the license on file, proper liability insurance, all the state requirements. So we take care of those. That's kind of an overview of what this is then. So I think what I'll do in the future, if you don't want me to review in detail the actual report, after the database report's printed, if you see I've got like kind of highlights, which is what I review with you guys, I think I'll just scan this in there so you can see the highlighted items that I would usually touch on. So right now, to look at what we've got here, I know Ken and some people online haven't seen this before, but this report reviews the provider on the left is the name of who we're have a contract with. I should note that these are all over $10,000. There's a lot of contracts that we have or agreements under $10,000 as well that I don't bring here for you guys to look at, but I do monitor them behind the scenes as well with the managers. So the managers listed as Jessica and Miranda, they probably hold the majority of the contracts that I monitor. Then it also lists the contract amount. So what's been approved by either this board or county board if required. The amount expended. So like I said, out in the county's checkbook, if you will, what I've added up as to what we spent real to date, as in usually about 2 months behind is what most providers are. So then the current month invoiced will be listed there. So you can see that that's all over the place. Some, if it's listed December, that means we entered into a contract with that individual placement, but we don't intend to do any business with them anymore. Either something happened or we just don't have that individual need anymore. Total amount expended is the next category. And then of course the balance, what's left to spend. And what I review every month
usually, which is what I'll highlight for you this time, is on the far right, I just look at where we're at with utilization. So right now, the majority of the contracts that I've looked at, we only have payment through March. So that's a 25% utilization. So on the far right-hand side, I look at what is exceeding that 25% mark. So on page 1, Toledo is at 31.99%. However, I also will have highlighted for you in the middle there, the current month invoiced. They've actually invoiced us a month ahead of time. So they're pretty much on track with their contract. So while it does tip over the 25% mark, they're actually right on track. A little further down is Forward Home for Boys. That is also at about 32% utilization. But once again, they've already invoiced us through April. So that should be on track. Page 2, the third one down is CISA 3. I'm concerned with that one because we have gotten bills through March, but we're well over utilization. And so this then triggers me from this report to get a hold of whatever the manager is. This is Lori Cooley, so I will be working with her on where she anticipates that to be. Page 3, everything looks good there. Page 4, about in the middle, Jessica Lineberger Counseling. She's at 46% utilization, which I've mentioned last month, and I have worked with Miranda, and we're going to be amending that a little later on the agenda. Perio, that's that electronic medical records, the fee that we pay every month. They bill us always in advance, so that's through April. And I don't know, Dr. Barris, if you saw Barb's comments on the chat here. She did notice a note that we do own the record. It's really heavily connected with IT and with Barb in her position. So she had, if we discontinue the contract, all records will be sent to us. So I don't know if you saw that. So that's Cario. Page 5, Northwest Counseling and Guidance Clinic is at 26.86%. So just a little over, but I usually monitor that one pretty closely every year too. We'll see how that goes. Just a few up from the bottom, Shea Rehabilitation and Psychological Services is at almost 40%. That was of concern last month. I have met with Miranda, we've discussed it, and that's another one that's amended on the agenda later this meeting. And page 6, everything looks okay there. Like I said, these are only our $10,000 or more contracts. So I think what I will do, if that's okay, if you guys don't want to review this every month, I can just do that. And then that really kind of highlights which ones. Obviously, then later on the agenda, if there's amendments we need to do, we'll talk about that. Comments from the committee? Sounds good to me. Okay. Thank you, Angie. That moves us to number 17, the director's report.
Thank you. So typically what I have done for a director's report is kind of share our updates from our agency and generally just to keep you aware of some of the things that are happening in our programs. So in terms of agency-wide news, I guess I'd first like to announce, I don't know how many board members know that I'm leaving my position. This will be my last Health and Human Services and Veterans Committee meeting. But the county administrator has named our ADRC manager, Roxanne Huberton-Skerber, to be the interim director of Health and Human Services if a permanent appointment is not made before I leave next Thursday. So I know Roxanne will do an excellent job in helping to keep our agency functioning and maintaining the status of our services. She has a great understanding of the agency, our programs, and the county. She'll provide good leadership during the transition time. Then with our other programs, behavioral health, both our outpatient treatment staff and birth to 3 and CLTS staff recently participated in the Get Real program through the Richland School District. The day provided a walkthrough of real life adult experiences, challenges, and resources for high school seniors as they transition into the adult world. Our outpatient staff are also working to bring nalox boxes to Richland County area. A nalox box is an emergency kit that can be placed in public areas and provide naloxone to bystander rescuer for a drug overdose emergency. Also would like to mention that May is Mental Health Month, and it is also National Drug Court Month. Last week, there was an article in the Richland Observer that discussed the success of our treatment court in Richland County, and next Tuesday, the WRCO morning show will be dedicated to discussing treatment court. In Child and Youth Services, our Child and Youth Services unit continues to be short of staff, but we do have an interview scheduled next week for a potential candidate, and we'll be welcoming a new case manager to the team at the beginning of next month, which I'll share with you on our personnel updates. And then economic support, the public health emergency, the federal public health emergency that was declared was extended to July 16th, which means people continue to be protected from losing their Medicaid through that date. Also, emergency food share has been approved for the month of May. And we're coming to the end of the 2022 heating season for WEAP, which is the Wisconsin Home Energy Assistance Program. After May 15th, regular and crisis emergency assistance ends. However, crisis prevention assistance is available year-round. A person does still need to be eligible for the regular energy assistance program in order to receive this benefit, and they would just need to complete an application. We have a newly certified Richland County daycare provider. That means that there's now one certified daycare provider in Richland County. We hope that more will become certified in the future to provide such a needed service in this area. I should note that there are a few licensed providers in Richland County. The state handles the licensing of daycare providers, and the county handles certifications. It's a different level of credentialing. But due to the lack of regulated daycares in our county, we have very few families who are able to take advantage of the Wisconsin Shares Child Care Assistance Program, which requires that daycare providers have to be certified or licensed. And then with our ADRC, staff have been providing numerous outreach presentations in the community regarding ADRC services. Over the last month, presentations have been given to the Women's Philanthropic Education Association, the Richland Center Legion Post, and the Viola Legion Post. The ADRC is also working with the Alzheimer's and Dementia Alliance of Wisconsin to host a legal and financial planning seminar for seniors on June 13th from 5 to 6:30 at the UW Richland campus. So this presentation will feature attorney John Haslam from Wilson Law and will include information about estate planning, advanced directives, guardianships, end-of-life planning, financial exploitation, and more. And the transportation program is going to be hosting an all-day required passenger assistance safety securement training for May 20th for our bus drivers, as well as bus drivers from Pine Valley Community Village and Schmidt-Woodland Hills. The training will be provided by the Wisconsin chapter of Rural Transportation Assistance Program. And then public health and nutrition. The nutrition program added a new clerical assistant to support our program services and operations. Request for meals remains brisk in our county, but availability of volunteers to deliver the meals is still limited. Public health continues to manage all facets of disease prevention and is working toward recovery from the pandemic. We're also attempting to resume essential services and initiate some new programming for our county residents. And then with regarding to the pandemic, Richland County is experiencing an uptick in COVID-19 disease transmission in the recent weeks. And the CDC has now elevated our community level from low to high, or excuse me, no, low to medium, I apologize. With this designation comes enhanced guidance on keeping both individuals and the community safe. The recommendations include keeping up to date on COVID vaccines. If you have symptoms, individuals should get tested and wear a mask. Individuals should also wear a mask if they have a positive test or are exposed to someone with COVID. And of course, anyone may choose to wear a mask at any time as an additional precaution to protect themselves or others. And individuals should consider wearing a mask indoors in public if they are at high risk for severe illness. I did place in your committee folders the most recent Richland County COVID data. So you can go ahead and take a look at that. I wasn't going to go through it unless you prefer. Thank you, Madam Chair.
Thank you, Director Tracy. Does anybody have any questions for her? Okay, I'm going to actually move forward then on our agenda. We're going to look at number 23, which is recognition of Director Thorson. I just wanted to say thank you on behalf of myself and the board for your work here. We have, you've been such a great asset to HHS and to our community and the county. I just really appreciate it. We're going to miss you. I've appreciated a lot of the positive changes that you've made, even just, for us in the way that the meeting runs and the information that you put forward. I know we don't see you every day to day and in HHS, but your what you've done has shown through in the last few years. I've appreciated your reports and the way that you've given us information. We're really going to miss you. So thank you and good luck to you in your next endeavors. And also we have cake that was provided. So thank you, everybody. Enjoy that. If anybody wants to get, I think there's coffee and water back there as well. You're welcome. Does anyone else have anything they'd like to add? Certainly.
Madam Chair, I assume the cake will be delivered to the folks on WebEx, right?
I was going to say, I'm sorry for all of you who aren't here in person. Although you're welcome to bring donuts to meetings. We won't turn those down. Right? There you go.
Madam Chair, if I may, I would like to thank the committee and the former Health and Human Services board members because the support that you offer is huge to the agency. We have an excellent management team and excellent staff, and certainly any success or improvements that have been made over my tenure are really due to those individuals. But I really appreciate the recognition, and I will miss Richland County. I think when I counted, I've been with Richland County for 29 years total on and off. So it's not an easy thing to leave you all. Thank you very much.
Back then to item number 18, which is the 2021 annual report. You've got that in front of you. What we usually do is we distribute this this month, and then next month we'll actually go over it. So that gives us time as a board to look through it, and we'll review it and approve it next month. So bring that back with you next month. Oh, thank you. So yeah, Angie pointed out, those of you that aren't in attendance today, they will mail those to you. So if you can remember to look over that and then bring it back, we'll discuss it next month. All right, so item number 19, that would be you, Angie, I believe, approve the HHS contracts.
Okay, so earlier we had talked about a couple contracts that we've been monitoring and that need amendment. So both of these are Miranda's. I don't know if you want to come up and explain if you have any questions. Jessica Lineberger counseling was at originally approved for 25,000. We're now asking for 49.5. The reason 49.5 is unique or special is because it's under 50,000, and any contract over 50,000 has to go to county board. So if this stays under 49.5, it will just end here. If it does trend over the 50,000, we'll come back here and then have to go to county board. The second one is Shea Rehabilitation and Psychological Services. So that's listed there as well. This is largely for CCS consumers. It started out at 100,000, is increasing to 300,000. So that will require county board approval. There's some little descriptions there in the middle block as to what these original contracts were approved for, and now we have an increased need. So we do usually, if Miranda needs to answer any questions, she can do that. But these are both, through behavioral health.
Does anybody have questions?
We'll just get an overview of Shea.
Shea Rehabilitation Services provides CCS or psychosocial rehabilitation services, therapy services in the community to our comprehensive community services consumers. So therapy going into individuals' homes and also working with individuals on activities of daily living. It's 100% reimbursed through the CCS Medicaid program.
Thank you. Yeah, that might be something we need to explain is that, okay, I'm going to do a bad job of explaining this, but if it talks about CCS in that, in the description, it's usually completely reimbursed. Is that correct?
Yes, both the Shea Rehabilitation Services and the Jessica Lineberger are CCS providers. That's really typically a walkthrough of money, and we bill CCS. They provide the services, we bill CCS, and then we reimburse them for their work.
Okay, so we will need, oh, yes, go ahead.
So this doesn't mean though, so we're going up to 300,000. This doesn't mean that we're going to spend 300,000. We just have the ability to go to 300,000. In the end, Shea Rehabilitation Services may only bill us for $150,000.
And that's what's important for that contract monitoring. That shows you real time what has really been spent as of March with Shea is right now we're at 39,512.
Okay, I will need a motion then to send that to county board.
Quick question on that again. Is the reason that we're requesting the increase of 200,000 is because we're using them more than somebody else, or is it because the need is greater?
It is both. Our CCS numbers, though they remain relatively steady, we are using them more, and yes, the need is greater as well. Especially looking back to the early part of this year, we had some individuals come out of those mental health institutional stays. And what we'll typically do is pouring those services into the community to have sometimes up to 7 days a week of in-home services in place to move down to a lower level of care from the hospital. But yes, so the need is greater. Our numbers go up. They fluctuate, but they stay between 40 and 50 or so clients.
Okay, if there's no other questions, can I get a motion? Okay, motion by Supervisor Severson, and I can second that. All those in favor, please signify by saying aye.
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 Any opposed? Okay, that moves us to item number 20. We're going to review options and make a recommendation to the county administrator regarding possible recruitment and retention incentives.
Thank you, Madam Chair. So, pardon me, I'll get this up on the screen here. So
On May 3rd, the Finance and Personnel Committee approved a motion instructing the county administrator to evaluate countywide how to address recruitment and retention in 2022. So that came as a result of action or a request for action from Health and Human Services at the last Finance and Personnel Committee, looking for utilizing our remaining funds from the previous budget year to address recruitment and retention items in our department. And the Finance Committee directed the county administrator to actually look at the entire county for those recruitment and retention efforts. So I'm coming back to the Health and Human Services Board primarily to, if this, committee, struggling to remember to say this is actually no longer a board, but the Health and Human Services and Veterans Committee, to provide some possible incentive options. And if this committee would like to recommend and pass them on to the county administrator, he will still decide what he would bring forward as incentive and recruitment incentives. Did I say that right? Recruitment and retention incentives, sorry. But I did want to share with you some things that we think would be helpful in our department and may also be helpful for other departments. So what I'll share with you in this handout that you have, these are the different ideas. Our entire management team shared some thoughts, and we put just a list of all the potential options that might be considered. I'm sure there may be others. Highlighted in yellow are the ones that I would recommend as a director for our agency be considered for incentives for recruitment and retention. So that would include implementing a consumer price index increase of 3% this year, and then also automatically putting into policy regular CPI adjustment to the wage scale on an annual basis. Also recommended, we've talked about some of our staffing difficulties for certain positions, looking at reclassifying those positions to a higher grade level on the pay scale. The targeted ones would be our child and youth case manager, moving that up one grade to grade I. The same with the adult protective services and APS crisis professional positions. Those are bachelor's degree social work level positions. Because of the difficulty recruiting in the specialized type of work that they do, that would be a rationale for moving them up one grade on the wage scale, as well as master's degree mental health therapists, clinicians. That is also an area where we've really struggled to hire, and we need to have master's degree therapist level personnel in our agency in order to function in all the ways that we need to. So that would be a recommendation to move that up a level. I won't go through every one of these, but I am going to highlight the ones that I would recommend. There are some bonus options that could be a sign-on bonus or a referral bonus if staff brings somebody to the agency. Another option, of course, would be to do a one-time retention bonus across the board. Another recommendation from my perspective is to do something with the health insurance. Currently, the county contributes toward the deductible of employees' health insurance. The current contribution is $1,000 for a single plan and $2,000 for a double. The recommendation would be to increase that to $2,000 for a single and $3,000 for a family plan. There are some other options here for potential changes to the health plan. I know there's a lot of talk about moving to the state plan, but that certainly is not possible for this year. So I did add it to the list, but it's not something that would be doable in 2022. And then finally, some other benefit improvement options. The county administrator, I think, is looking at improving the vacation benefit. And so I've included what's currently been drafted. I don't know if this is exactly what he's currently planning on doing, but this is what most recently was drafted. So those would be the recommendations I would make, but this committee could, if you think that something else either is on the list or not on the list, you could make a recommendation to the county administrator. And then, Madam Chair, I know you mentioned asking about the amount that is being returned to the general fund. So at the end of every year, if there are funds remaining in a department's budget, it goes back to the general fund. And 2021 was an exceptional year for Health and Human Services because of many factors, things that were different funding sources that we did not anticipate or came right at the end of the year. And so we are expecting roughly $650,000 to be in remaining funds to our core budget at the end of 2021. And then after any deficits in the placement funds have been covered, that amount would be about $450,000. And so that would be a funding source to try to address some of these incentive options. That's all I have, Madam Chair.
Thank you, Director Thorson, for preparing that. Thoughts from the committee?
Madam Chair,
Yes, Supervisor Gatchall.
I like all of these options for various reasons. I guess I personally would lean more towards kind of an acute finite adjustment that's more targeted towards HHS, keeping the folks that are still there. And if we could do anything to lessen some of the difficulties that we've had recruiting for some of these positions, I'm certainly on board for that as well. But I think something very targeted towards the staff that are currently working to retain them through fiscal 22 would be my pleasure, and that makes it a little easier to tie to our budget surplus, I think. Some of these things are probably sufficiently overdue, in my opinion, county-wide, and I do think, as this moves on to Administrative Langrick for consideration and entire county consideration, I don't want to lose what kind of the immediate goal that we're going for here.
So are you saying then that you would want to recommend forwarding this, but highlighting the option that you would prefer for HHS, or do you want to amend it differently?
I am not sure. I just wanted to throw that out to the board for consideration.
Okay. Other
Standing
members?
committee.
Madam Chair, so we're just looking at options. So the administrator, Clint, and basically we're just doing exploration right now, correct? Are you looking for some kind of motion?
We would want to make a motion to forward on our recommendations here. If you look at the recommendation language at the top there, I think is what you were looking for, correct, Tracy?
Yes, Madam Chair. If it's the committee's desire to do so, that the committee would be formally taking some action in making a recommendation to the county administrator. It's certainly up to the committee whether or not you want to do that. The county administrator will receive this from me anyway, but I think the committee was pretty invested in helping us last month in trying to forward something on. And so I'm bringing it back so that this committee can have a voice in that.
Does that answer your question?
Well, this is a very difficult situation we're in, and it's everywhere. Being a former employer and still in contact with many employers, I don't have an answer. I know that there's issues with everything, like sign-on bonuses with a time limit on them. HRs are finding that when that time limit hits, they're skipping town. So I think it's a multifaceted answer. You've got to be very careful. I personally, after owning a business 30 years, I like the one-time increase, base it on the CPI, but tying future county boards' hands to a mandatory thing, I just don't see that. I don't like tying anybody's hands in the future. But as far as doing something now and retaining the people we have, obviously we've got some good ones. I'm all for that. We're looking at 8.3% inflation. You want to do 3%, so you just do simple math. But I've spent a lot of time thinking about this because I still have family that own businesses, and it's a revolving door. The world of loyalty, loyalty and employment left a long time ago. Any other?
I do want to ask, I know, Tim, you sit on finance and personnel. Carrie, do you as well? No? Okay. I was sitting in on this portion of the meeting when the previous motion was discussed there, and I think you mentioned, I guess I'm a little confused as to what did they decide? Were we supposed to only recommend forward recommendations for the entire county? Or was there some talk of if we had, I thought I heard like if we had some sort of plan for how we were going to utilize the funds specifically in this department, that perhaps it would be a consideration.
If I may, Madam Chair,
Yeah.
what I recall from the meeting is there was a question. We weren't bringing a specific plan to the Finance and Personnel Committee last meeting. And there was a question that if they had a more specific plan, it would be easier for them to consider it. Ultimately, what ended up happening was that motion was approved by the committee to direct it to the county administrator to make a decision and bring forward a plan that would be for the whole county, but would be implemented in 2022.
Okay, so they did not allow for narrowing it down to HHS then?
That's my understanding.
All right.
Madam Chair.
Yes.
Administrator Langrick, are you still with us?
I am on, Supervisor Gatchall.
All right. Not to put you on the spot here, Clint, and please tell me if I am doing so. What a consideration from HHS that fit into a larger county consideration for 2022 be worth considering, or is it not your preference to look department by department in that nature?
Can I have you state that again, Supervisor Gatchall?
Sure. If we just making things up now, recommended we want $500 retention bonuses for HHS in 2022, or that would be our recommendation. We're going to pay for it with our surplus in our fund. Would that still meet the mission that you've been charged with as kind of HHS's portion in a larger county consideration, or are you specifically looking for countywide options?
No, from the take I had from the committee was to try to find a solution that is going to work to meet our immediate needs of recruitment and retention. I still have previous marching orders from finance and personnel onto incorporating some of those things of a CPI increase with like a wage and compensation policy so that employees know when and how they're going to progress through our wage schedule, and currently planning on a CPI increase as well as taking one or multiple steps yet on our Carlson study for the vision is for the majority of our employees at this point. Did that answer your question?
I think so. Madam Chair, with that in mind, I think I would make a motion to refer this entire document with the support of the committee to to Mr. Langrick. I like leaving the highlighted elements on it as well, as stating that we've considered Director Thorson's recommendations and we're behind those recommendations, knowing that she knows what's best for her staff and department. So yeah, I would make that motion.
I would second that.
Okay, so we have a motion and a second. Any discussion? All right, well, then all those in favor, please say aye.
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 Any opposed? Okay, and I just want to say thank you, Director Thorson, for putting that together. I appreciate the work that went into that, and I like it a lot. All right, to item number 21, approve amendments to HHS Addendum, increase on-call compensatory time reimbursement rate.
Madam Chair, we have Jessica Stanek, the manager for Child and Youth Services, who is going to speak to this.
For those of you who don't know me previously, my former name was Stanek. I got married last year and it's Tisdale.
I apologize.
And
Jessica.
everybody who's known me for a long time continues to mess it up, including the courts. So just wanted to clarify for those of you who may not be as familiar with, I'm both people essentially with everybody here. So this proposal is coming from the Child and Youth Services Manager with the support of Director Thorson. We are requesting to approve amendments to the Health and Human Services Addendum to the Employee Handbook in order to increase the hourly on-call compensatory pay to $2 per hour for on-call duties and $2.50 per hour for on-call holiday duties, and to forward this recommendation to Finance and Personnel and County Board approval. So some information behind this, I can tell you I have been with the Child and Youth Services team for 10 years, and there has not once been an increase in the on-call pay for our unit. And I can tell you that in consultation with Director Thorson, she recalls that the same pay was prior to that as well. Our payroll doesn't go back that far for me to be able to see when the last increase, if there was ever an increase to that on-call pay. So Child and Youth Services is mandated to do a 24/7 on-call rotation and cover to take reports of abuse and neglect. With that, our Child and Youth Services staff, as well as a supervisor on call, are on call all day and night outside of the county business hours. So from 4:30 p.m. until 8 a.m. the following morning, during all weekends and during all holidays when the building is closed. So we are requesting to increase that on-call pay to, again, $2 per hour for regular days and $2.50 per hour for any on-call duty days. We're feeling that this is a big thing for Child and Youth Services because it's a recruitment and retention effort that we can put forward to try to keep the people in our unit that we do have. As you heard earlier, we are functioning 3 staff low, which means the on-call time is pretty extensive for each person. We are also seeing the turnover within Child and Youth Services is frequently due to the on-call requirements of the job, as well as people transferring within the department who do not wish to remain on call, even though they have the capacity to do so because it's not a requirement of their job. So although Child and Youth Services are passionate about what we do and we are all in to ensure child protection during any hour of the day, again, we're advocating for the increase in compensation. Under this, we have been able to, under the budget, is we would be utilizing our normal state allocations to cover this. And in reviewing our budget over the past several years, we do have the capacity to fit this within the allocations that are already being received. So there's no additional tax levy or any other funding source that we are requesting for this, where we would be utilizing the normal allocations that our department receives. And the increase of the pay from the current rate to for the increased rate would be an additional, it's actually a little bit under 11,500. So we would stay with under the 11,500 that is noted in there to increase that pay on a yearly basis. Is there any question?
I have a question. Any idea, just a ballpark, like how many contacts or calls are we taking in like in a 1 week period, a 7-day period?
It's quite variable. Sometimes there are no calls in a 7-day period, and sometimes we'll have to respond to situations on 3 or 4 occasions in that week. It's with having such a small county and things like that, it really depends on the other things going on in the county. Traffic stops, people getting in trouble, arrests in the county, just different situations, domestic incidents. Sometimes we're called to all of those things with law enforcement. So again, it's very variable just because of the size of county that we are.
So you're basically just looking at shuffling money in your own budget.
Correct.
That's correct.
I would make a motion that we accept the amendment.
Do I have a second?
A second with discussion, Madam Chair.
Yes, discussion?
Jessica, do you have an idea if this is in line with our surrounding counties, the proposal?
So some of the surrounding counties actually do not pay some of their on-call staff, and some other counties require that any social worker within the department is required to do the on-call rotation. We currently do not require anyone outside of the Child and Youth Services team to do that on-call rotation. So each county really runs things differently. I would say the counties that run very similar to us, they probably are still in excess of what we're requesting our increase to be.
So their rates are potentially higher than even what we're requesting.
Correct. They are larger counties who run very similar to our on-call system.
Sure.
So they do end up responding more as well. So their compensation, I think, is a little bit more than ours.
Okay, thank you.
Question.
Yes.
Do you, with the staffing shortage, have you contemplated or looked at possibly bringing on some of the other workers to free up the workload, to spread it around more?
We haven't gone to that at this point. What's required for a staff person to be able to do these after on-call duties is they must become a juvenile court intake certified, which is lengthy. I guess when it's all together, it's probably a full week of training. Is that correct, Jessica?
It would be in excess of that. So you would have 2 safety trainings that would be required, which are 3-day trainings, and a juvenile court intake training with a passing of a test, which is a 5-day training that would be required in order to be able to take custody of juveniles.
So it would be really a larger decision to identify staff who should be receiving that training and doing that. So we have not gone that route at this point.
Well, if Clint's still listening too, I'm thinking this is possibly a way we have to go to ease up some of the manpower shortages, is to cross-train people, that we have on staff. Nothing else that makes them more well-rounded to know what's going on. It's just an option.
Certainly I would say there's pros and cons to that. The advantage is certainly what you're stating, that then we have more staff to draw upon. The downside of that is just what Jessica pointed to, that some staff, because of what they do in their day job, really aren't cut out to do this type of work, and they probably wouldn't stay with the county. So we could create a bigger retention issue for ourselves. Also, this is very specialized work. So, for example, asking like an adult protective services worker who doesn't typically work with children to step into this role might be asking them to stretch a little bit beyond their comfort level and capabilities. So certainly some counties do this. Most counties that I'm aware of kind of start to move away from that because of that specialization piece.
Makes sense. You can't make a plumber and electrician.
Any other discussion? Supervisor Severson?
What is the on-call pay for our EMTs and EMS? I think it's relatively the same.
Are you
And
asking me? Because I don't know.
well, at least Administrator Langrick, but I see he's having some issues up there. I think for the weekend, I think should be up to $3 an hour. Be comparable with some other departments that have to be on call too.
Supervisor Severson, this is Administrator Langrick. I'd have to track that number down. Stand by.
From what I'm getting on our wage scale thing, it looks like it's $3 an hour for weekends and holidays.
As Jessica alluded to, though, I mean, it might depend on how many calls you're responding to. She mentioned like the larger counties that pay more would obviously be responding a lot more.
Excuse me, Madam Chair. Actually, this is a rate that is paid for those staff to be available on call. So whether they're getting calls or not, they get paid that $1.25 an hour throughout the night. If they get called, then they are accumulating comp time. So it'll be the same amount no matter what, depending on how.
Right. I just meant that base rate. I don't know if the amount that you would wind up having to respond affects that at all.
No, I think, like I said, the responses are tracked differently because we do receive compensation for calls that we receive in the time we're out in the field through comp time. But this is just like the increase in, we used to call it pager pay because when I started, we actually carried pagers and then used our personal cell phones to call people back to take reports of abuse and neglect. So now we've changed the naming of it a little bit because it's not pager pay, but most people in our unit still refer to it as that. I think any increase, and I think this increase is just something that I was able to advocate for that would make the staff feel as though we're doing some efforts to recruit and retain the staff that we have for on-call purposes. It's something that we have within the power and within the budget to do at this point in time. And we felt that this was, just an accurate representation of a pretty significant increase. We're talking 75 cents an hour per regular hour and $1 an hour per holiday time. So I felt like that was a pretty significant increase that I could advocate for doing the job for the past 10 years.
Would the $3 an hour affect your budget if you did the weekend and holiday?
Yeah, I'd have to go back and run the numbers and see what those would be. I don't know what the increase, because it wouldn't fit within the increase that I don't think that I've requested here today for the 11,500.
I would just say that this year we could, because of our vacancies and some of the budget savings, we would for sure be able to make it work, but we haven't costed it for, an ongoing basis. We get a finite amount of allocation from the Department of Children and Families at the state level. And then any expenses we have related to this can be claimed against that up to that finite level. So yeah, we would have to cost that. I certainly in spirit would support that just for consistency purposes, as well as, it's a big deal for staff to kind of put aside their home life to be available and do these things.
Get it 100%.
Director Thorson, just to clarify, when you said that we wouldn't be able to necessarily cover that in years going forward, you're talking if we increase to the 3. If we increase to what we're saying today, even if we get more staff, it should be able to be covered. Is that correct?
Yes, we have costed it for ongoing what we're proposing here. We just haven't costed that additional 50 cents, so I wouldn't be able to answer that.
Thank you.
Madam Chair,
Right.
Yes.
will you keep quorum if I bid you farewell?
That's a good question. We are missing Supervisor Seep and just a member. Is there anyone else?
You're also missing member Lou Van Landij.
That's just 2, so that'd take us down to
Barb
3. We
Voss.
should still have quorum.
Wasn't Barb on this?
I don't think so when I look at the new setup, no.
Madam
That's
Chair,
shuffled.
it looks like there are 2 other, the veterans representatives are still, as well as, yes, Supervisor Rudersdorf. It looks like we have enough.
So yes, Supervisor Gatchall, we should be fine.
All right. Thank you. Have a good day.
Thank you. You too. Okay, so I see Clint has put up their ambulance on-call weekdays, $1.25, weekends and holidays is $3. So between the two, it's similar, I guess. Any further discussion? No? All right, let's vote then. All those in favor, please say aye. Aye. Any opposed? Okay, that moves us to agenda item number 22. Approve the use of the ARPA funds set aside for public health to hire a consultant to assist with the development of the community health needs assessment, community health improvement.
Madam Chair, this is one of those items that once we have that local board of health in place, that could be the board that speaks to this. But because we're really talking about request for utilizing funds, I think it is appropriate for this committee to go ahead and take action. And our health officer, Rose, will speak to this.
It's not slide it forward.
To read through the committee. Hopefully you've had an opportunity to review the attachment or the board mail out or committee mail out that was put forward for your consideration. The process of creating or completing a community health needs assessment and then also completing its companion document, the Community Health Improvement Plan, are statutorily mandated processes that local health departments engage in on an every 5-year cycle. As it just happens to occur, 2022 is the beginning of a brand new 5-year cycle. And given the fact that our nursing staff, that would include myself and the 2 nurses that we have hired full-time, are continuing to engage in the COVID response and are working toward engaging in as many COVID recovery related activities that we can. And in addition to trying to reestablish essential services that we provided in the past. And because of some of the categorical funding that we receive different types of funding from the state based upon the category of activity that we should be performing. There are expectations that we begin the process of initiating new programs as well. So given that we've got competing interests that are consuming actually pretty much all of our time at this point, we are considering, or we are looking at the possibility of retaining a consultant to complete that community health needs assessment and then to work as well on the community health improvement plan. And we were very fortunate that Richland County agreed to take some of the American Rescue Plan Act dollars and allocate them to public health activities. And as a result, knowing that that the use of a consultant to work on these particular processes will support public health, it would also support us as far as our time and effort is concerned, but will also form the basis of our infrastructure as well. The information that we receive from our community and the plans that we put in place to address these needs will serve as a basis for strategic planning. It will also help us to more effectively target our resources, our time, and our dollars so that we can address issues that are identified during this process. I do have a proposal that the consultant provided. The total amount that she indicated was, I believe, $40,020. And I think we used the amount of $41,000 just as kind of as an upper limit of that amount. She has proposed that she could help us over the course of a 9-month period to engage the community and to perform data analysis as well as to complete and develop a plan. So I'm asking that the committee consider my request and move that forward to our Finance and Personnel Committee as well as the County Board. And it would be a request for an apportionment.
So, Madam Chair, if I could just kind of add to what Rose is saying. So this is a pretty reasonable consultant fee for what we're asking to be done. So we feel that that's an appropriate amount. And really what we're asking for is the ability to use some of those ARPA funds or American Rescue Funds for this purpose to support public health. And this would have to go on to Finance and Personnel and then I believe on to County Board.
So maybe you just answered this question, but it says in the financial review that they'd previously approved $335,000 for public health response. Is this 41,000 included in it would be taken from that amount?
It would be taken from that amount, Madam Chair. Yes, I think back in August of 2021, the Finance Committee, based on the county administrator's recommendations of how they would apportion all of those ARPA funds, which is $3,300,000 and some thousand dollars, that I think 10% was set aside for public health utilization. And so it'd be asking to use 41,000 of that $335,000.
Can I ask how much has already been utilized?
Zero.
We have had other funding sources that we've been able to utilize to support our disease investigation and other response efforts. Those particular dollars, these are federal dollars that the state of Wisconsin is administering, and then we've been able to benefit from that for our immediate response and some of our recovery activities. However, this particular type of work is not included in those streams of funding. So we would have to utilize or look at other sources of funding to help support us in that regard. And the work that our nurses are doing right now cannot be supplanted by some of the COVID funding that we're using right now, because it is public health's job to respond to communicable disease and to perform disease investigations and the myriad of activities that go along with that. So we continue to pay our nursing staff as they normally are, and it's for the extra or additional activities that we've engaged in, whether it's been nursing staff or whether it's been contracted or individuals who we've utilized through Health and Human Services. That's where the funding for COVID that has come from the federal and state government has been utilized. So it's fairly restrictive as far as how some of that funding is used, but we've been utilizing that, and we haven't. And there are some earlier timeframes too that we would like to utilize that funding with. For example, some of it expires in 2023, some of it in 2024, and if we're able to utilize that appropriately, we'd like to take advantage of the funding that expires first. And right now, in order to engage in an activity such as this, the COVID funding that we've received doesn't support.
One other question. So in previous years, when you've performed this analysis, has it just been you that has done this?
Actually, this predates me. Actually, Mary Ann Stanek was the health officer at the time. She actually engaged in the process along with a community health educator that we had hired, Betsy Raisler. Betsy and Mary Ann, and then we also had, after Mary Ann left, we had the benefit of having an AHEC intern. Betsy and our AHEC intern finished the final product, and that occurred. I think they finished it probably in 2020 or thereabouts. So we were several years into the process already. And Cindy, you may recall being
yes,
a
it was done it was done in conjunction with the required community health needs assessment that the hospital had to do because of its critical access status. So it was a real community. It was a real community health needs assessment from several different aspects, and then public health developed their community health improvement plan, and the hospital also developed their own. But it was good to work on it together because we could pick up where others weren't able to and back up some things in the community.
Okay, thanks for the clarification, because I remember the hospital being a part of it, but do they not need to renew theirs on
Actually,
the same?
we're having a meeting at 4 to start the process at the hospital.
So is there something stopping from working together again?
I don't
Would that
think so.
affect this?
I don't know.
Other than time and effort, I think
Right.
it's just amount of time that
Right.
public health can devote to being an active participant at this particular time. I
Right.
think that that's part of the reason for making the request.
Right, and we've worked with, on another committee, I would just put in a word of recommendation for working with Dorothy Cheney. She is excellent at what she does and really knows her stuff.
So Madam Chair, just to add, your question is whether or not it would, if this would prevent that kind of collaboration, it would not.
No.
That collaboration could still help, could still be done with this consultant being involved.
So Rose alluded that there is some funding that would expire. Is there risk of it not being utilized if we're?
There's a large amount of funding that the state has passed through from the federal government down to the counties. And so we do have large allocations. Probably some of it will expire without us using. It'll go back to the state. It's just when the pandemic started and the funding started flowing, they really poured a lot of money into making sure that public health could continue to function. I don't believe that we'll have the expenses to reach the high level of funding that they made available to each county. And that would be true across the state, that many counties won't be able to utilize all of that. But it ensured that we wouldn't be hamstrung by not being able to act.
Okay. Any other questions?
Question. So as I read this, are we looking at this as just you said something about a 9-month, so is it a one-time 9-month contract?
Yes.
And we would have to review this again next year?
I don't believe so. I think that depending, of course, 9 months may extend into 2023, but this would be a one-time request because once this particular project or this process is completed, it actually suffices or fulfills that obligation for 5 years.
Questions? We'd be looking for a motion here then.
I would move to recommend approval.
Okay. Do I have a second?
Gary Severson seconds.
Discussion? All right, all those in favor say aye.
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 Any opposed? Okay, thank you, Rose. That moves us to agenda item number 24. We're almost done, folks. HHS personnel update.
Thank you, Madam Chair. So we do put a memo into your folder every month. Angie kind of compiles all of what our personnel changes have been. I'm just going to summarize that quickly here. We have at Health and Human Services, we have our county employees, and then we also contract with Southwest Workforce Development Board to hire staff. We call them leased employees. We lease them, and they function essentially as members of our staff and do work side by side with our county staff. So you'll hear me mention Southwest staff, and that's what I'm referring to. So in terms of new staff for Health and Human Services, Alicia Woodhouse is a Southwest limited term family preservation worker who began on April 25th with the Children's Unit to help out with doing things that our social workers don't need to do, so that this being short of staff, it helps supplement some of the supports needed. And then county staff, Hannah Udelhoven will be a new Child and Youth Services case manager, so that will take up one of those 3 vacancies that we were talking about in Child and Youth. She's been hired and will start on June 1st. Some other staff changes, and I'm jumping around on the memo that you have. I was trying to figure out how to streamline these categories a little bit. Brady Donahoe is a county staff. She's been the Child and Youth Services supervisor. She's made the request to transfer back to a Child and Youth case manager. So she is transferring out of that supervisor position to the case manager position, and that was effective on the 11th. Diane Cox is a Southwest limited term adult protective services worker. She revoked her resignation because we were able to hire APS worker, and she has agreed to stay on and help train that individual. So she'll stay on maybe another month or so just to provide that training. We have 3 staff who completed their probationary periods. Amanda Oman is an economic support specialist. Darian Ostrowski, also an economic support specialist, and Emily Phelps, child and youth services case manager, all completed, will complete their probation at the end of this month on May 29th. And unfortunately, we do have a few resignations to report. Julie Bollinger Jones is a mental health therapist. That's one of those master's degree clinicians that we've talked about, as well as Tricia Morzenti, also a master's degree mental health therapist. Both of them are resigning their positions effective the 26th of May. We do have several county positions that are currently open, and we're attempting to recruit. Certainly my position is one of those. I believe interviews have happened, and the county administrator is making either a decision to do a second round of interviews or offer a position. Behavioral Health Services has a CCS supervisor, and I think we had planned some interviews, but those are being delayed. And APS crisis professional position is currently on hold. And then we now have 3 mental health therapist positions that we are currently advertising for master's degree clinicians. After we bring on board the individual for Child and Youth Services on June 1st, we will have 1 Child and Youth Case Manager position opening, which we're currently interviewing for, and then we will have 1 Child and Youth Services Supervisor, which we're currently advertising. There are some other county positions that are on Health and Human Services books as open positions, but we are not pursuing filling those because they were not included in our budget, and so they still are listed as positions, but we, because we didn't add them to our budget, we're not recruiting for those. Madam Chair.
Just a question, Tracy, when it says on hold, is that 90-day holdover where they review the job description?
No, it's on hold because we may be adjusting some where we think it's better to utilize the funding that we had budgeted for that. So certainly that is something that can happen where a position is vacant and we do that 90-day kind of review, but that's not the case here.
May I ask a question too about the on hold potential staff, I guess? What plans are being made or can be made to move those forward more? So for instance, I know that the health and wellness coordinator under public health has been on hold, well, since before I came on the committee at all. And it's a position that many other counties have more than one of, and we have none.
So you might have heard Rose mention Betsy Ressler had been in that position kind of on and off at times, and funding really is our biggest constraint for that. We haven't been able to find the funding that would be necessary without asking for additional tax levy for that. And certainly I agree with you that many counties have that, and it's a very valuable position, but that is why it's on hold currently.
Because in many of those counties, one of the skills that they have is writing grants to support the funding that's necessary.
And I would say that when you have someone who has that knowledge base and that skill, it's substantial. And I know that Betsy certainly had that, but of course she stepped down because she's working for the school district and doing really good work for the county in that respect. So, yeah.
Yes, she is. She saw an opportunity that was well within her heart's work, I guess.
Great, thank you. So agenda item 25, the future orientation. Let you speak to that a little bit.
Sure. Typically there's been an election and new county board supervisors have been elected, what we have done in Health and Human Services is provide an orientation to Health and Human Services. You can tell by the length of this meeting that there's a lot of detail that we deal with. Health and Human Services is a compilation of, gosh, I won't be able to say it off the top of my head, 6 or 7 different kind of program areas. All are kind of very specific to what they do. We essentially administer state programs. And to really give you a good idea about when we're asking you to make approvals, it's nice for you to have some background as to what those programs do. So we would like to offer an orientation not only to this committee, but also to, we always invite county board members as well. Some proposed dates that Angie suggested in looking at when we both have availability and space for availability of our management staff as well as space would be June 21st or July 19th. This is usually a 3-hour orientation to try to really give it enough substance so that you get the information on these programs. It will be a heavy lift for us to do it by June 21st, but if that's the time that the committee selects, we will do that. We have a preference for July 19th just to make sure that it'll be a little easier on our staff.
Most important opinion would be of our 2 new board members. Supervisor Renish or Rudersdorf, do you have thoughts on that? I would highly recommend that you attend those because it is very useful information.
Yes, I'm okay with the July 19th if that gives them more time.
Okay.
Well, on the 21st, I've got to be on.
Yeah, we're looking at like a 1 to 4.
I don't think I was able to attend the last one. I think I might be out of town on July 19th, but I think we can go with that one because that works for you guys. But
thank you. We'll have something to eat. Of course, I'm leaving, so.
Number 26, does anyone have future agenda items they'd like to add? Director Thorson, did you think there was anything?
Not a future agenda item, but when we talk about orientation to the agency, we'll actually, next month, the managers will go through the annual report, and that's an orientation sort of in and of itself. So if people aren't able to attend when we have the orientation, this would be a nice supplement to that.
Thank you. All right, so that moves us to adjournment. I will say, I hope not our future meetings, we can streamline this. It won't be quite so long. However, as she just mentioned, we will be going over this next month. So I would say gear yourself up for this. The meeting where we go over this is even before we combined committees is always a bit of a longer meeting because of that. After that, hopefully we'll be more streamlined. And so the date then, it looks like we're going to be June 9th. Is that what you have? Okay, so we're adjourning to June 9th, 10:30. Can I have a motion?
Harry Severson.
Okay, and a second?
Second.
Second by Dr. Veras. All those in favor say aye.
Aye.
Aye. Any opposed? Okay, thank you all for your patience.